Subclavian Steal syndrome refers to a phenomenon observed during a cerebral angiogram, where blood flow is stolen from the brain's circulation due to a significant blockage or stenosis in the subclavian artery. This condition typically affects the vertebral artery, which is one of the major arteries supplying blood to the posterior part of the brain. How subclavian steal occurs. When there is a blockage or narrowing, stenosis, in the subclavian artery, typically near its origin, the pressure in the subclavian artery decreases. As a result, the vertebral artery, which normally branches off from the subclavian artery, may experience a drop in pressure and blood flow. To compensate for the reduced pressure in the subclavian artery, blood flow in the vertebral artery may reverse or steal from the brain's circulation and flow backwards into the subclavian artery to bypass the blockage. This is known as the subclavian steal. Reduced cerebral perfusion. Because blood flow is diverted away from the brain, it can lead to reduced blood supply to the posterior brain, causing symptoms related to poor perfusion, including dizziness, syncope, fainting, visual disturbances, and, in severe cases, strokes. Reduced cerebral perfusion. Because blood flow is diverted away from the brain, it can lead to reduced blood supply to the posterior brain, causing symptoms related to poor perfusion, including dizziness, syncope, fainting, visual disturbances, and, in severe cases, strokes. These symptoms can be intermittent and may worsen with exercise or arm movement due to the increased demand for blood flow. Diagnosis. Subclavian steal is often identified during a cerebral angiogram or duplex ultrasound. In a cerebral angiogram, reverse blood flow can be observed in the vertebral artery when imaging is performed after contrast dye injection. This reverse flow pattern is indicative of subclavian steal. Treatment. The treatment depends on the severity of the stenosis. Options may include angioplasty and stent placement in the subclavian artery to restore normal blood flow. Surgical bypass is another option if necessary. Medical management for less severe cases or for patients who are not candidates for invasive procedures. In summary, subclavian steal syndrome is a condition where a blockage in the subclavian artery causes abnormal blood flow, leading to decreased cerebral perfusion and potential neurological symptoms. It is often revealed during a cerebral angiogram when abnormal flow patterns in the vertebral arteries are observed. Next on AngioSavvy, brain aneurysms and treatment options. If you like the contents we include in our channel, please click like and subscribe to our channel. Thanks for watching.